What is a dental crown, and what materials are used to make crowns?
A crown basically replaces a tooth structure that's been seriously broken down on the actual tooth itself. So when there's extensive loss of tooth structure or compromise of tooth structure from decay, wearing down of the tooth materials itself, or trauma, it's important that the tooth be covered again. You know, the term cap used to be used for decades, but in reality, we're not talking about capping something, we're talking about restoring its external form. So oftentimes this requires a 360-degree drilling process around the entire periphery of the tooth and the biting surface of the tooth, replacing it then with an entire crown form. We might be looking at a crown form that had a metal understructure, and then porcelain was baked over the top. This was a fine restoration, and it provided tremendous aesthetics. Unfortunately, as the gums might recede a little bit in many instances, you may recall seeing a patient that when they smiled, you would see a little darkness at the gum line. It may represent actually a little bit of the metal collar that would exist originally below the gum line, but now due to the recession, it's in view, and it creates some significant discoloration. No one's happy about that. So the beauty of these new all-ceramic restorations is, for example, if you had several teeth that were your own natural teeth in the front part of your mouth and you were smiling with that, but then you needed to replace one or two teeth with crowns, to be able to have these crowns indistinguishable from the natural teeth adjacent to these sites, today with the new all-ceramic restorations, it's doable, it's possible, and the outcomes have been unbelievably aesthetic, and the ceramics itself is much, much stronger structurally and functionally.